I'm Andrea Leishman-Barb. I'm from Omaha, Nebraska. I grew up in Kansas, moved here to go to Lincoln for undergrad, and went to medical school in Kansas City and then came back to practice here in Omaha. I chose OB/GYN because I love the education in young women. I love the surgery parts of it. I love deliveries. I love connecting with women over their health issues. Probably the most common conditions that I treat are irregular periods, people complaining of irregularity or very heaviness in periods. I like to give them options that include medical treatment, least invasive, all the way up through to surgical options. Also menopause, I deal with a lot of women who are starting to get into that age, and I really enjoy talking about hormone replacement, about and educating them about options that are right for them. Also, adolescent and teenage education I really enjoy, and really any part of obstetrics. When the patient first comes into the room, or when I first come into the room with the patient, I like to sit down and really get to know them. I like to I really ask all of their health history over again, because I really want to be well aware of where they're coming from, and then just to find out what they're there for and how I can help them. You know, I really enjoy working in academic medicine. I trained at a very academic program. You get to be on the cutting edge of medicine. You get to be a part of teaching nurses and medical students and new physicians, residents that are learning, about your craft. And there's a lot in academics, there's a lot of science in medicine, but there's also a lot of art, and I feel like that is part of how I can help educate them. I love that patients get to come in, they ask us to be a part of their decision-making process in their healthcare. I look at it very much like a team, and I'm here to give them as much information as I can and help them make good decisions about what issues they're dealing with.